So I guess the plan of action would be to talk about physiological changes in weight versus pathological changes of weight. And then I suppose consider causes of pathological weight loss and how to work through them. As we talked about, obviously there are changes in older dogs as they get older, and one of the things is the amount of lean body mass that they have decreases. So the amount of musculature in particular declines as they get older, just as it does in people. And it can be quite difficult to decide what's physiological versus what's pathological. Unfortunately, I'm not going to have the actual definitive answer for you. I don't think there's a rule, I'm afraid, but it can be quite difficult. Things like weight are vulnerable to changes for lots of reasons. So you could have less muscle but more fat, So who religiously records the body condition score in the notes? Ah, cool, lots of people. Muscle condition? Occasionally, yeah. I usually always write the body condition, but I only write muscle condition when it's bad. So maybe everyone does it. So recording both is probably useful. And when you see a patient, occasionally you can often appreciate significant loss in muscling if there's something going on. Thinking about the energy requirements in older patients, in older animals, your basal energy requirements decline as you get older. Your basal energy requirements are largely determined by your lean body mass. So as your lean body mass goes down, the energy that you require is less. And that's probably a lot of the reason why we see a lot of obesity in middle-aged animals, because their energy requirements are going down, but nothing else is going down, i.e. their food intake is the same. In older animals, they do have an increased amount of protein turnover as well. As geriatric animals get older, we see an increased incidence of underweight animals versus the increase in overweight animals that we see in middle age. So why do they start to lose weight as they get older? So their energy requirements are declining, but they're also losing weight. There are probably a multitude of reasons. So there are some changes in the gut, in the way, the anatomy and some of the physiology, but they're not thought to interfere with nutrient digestion. This situation is really different to the cat. So in cats, about between 15 and 30% of cats have problems with protein and fat digestion. So the kind of efficiency of digestion in cats goes down as they get older. So that's one of the reasons why cats lose weight when they get older, that unless they can crank up their food intake, they will lose weight. And obviously remember, lots of these senior diets are calorie restricted, which may not be the best starting point if you have a cat who's in slim condition already. So the gut kind of stays working the same. Some of it maybe changes in appetite. So as patients get older, they have just less appetite generally. And I always recognize that in older people around me as well, right? They start to be a bit more like birds with eating. And maybe changes in the special senses, so they're less stimulated by smells and stuff, might also be relevant in older dogs. So they may eat a bit less. We know that they have a higher protein turnover, so they probably need more protein in their lives. Maybe some element of this is undiagnosed illness.